I'm really pleased to introduce our first guest presenter, Danielle Castrique, who's a consultant social worker, who's going to talk to us about neglecting teenagers. And this is an issue that has been particularly raised, really coming out more than anything from the NSPCC review that took place a couple of years ago now, looking at kind of harm to adolescents, with the neglect being one of the key areas that they focused in on that one. So Danielle, if it's okay, I will hand over to you.
Yeah, afternoon, everyone. Um, yes, so as Steve just said, so my name's Danielle Castrique. I'm a consultant social worker in Somerset, and I'm going to be giving you a bit of a whistle-stop tour of adolescent neglect and kind of what that looks like, some of the research behind it, and then kind of where you go from there. So just to start with, we're just kind of thinking about that idea of the kind of the adolescent brain. So obviously recent discoveries in neuroscience, have shown that there's a lot of development, isn't there, in our brains during those kind of early teenage years. And there used to be the idea that children became adults kind of around the age of 18, and what we now know is that actually that development in terms of your brain continues until you're well into your mid-20s. So actually, when we're thinking about how we care for adolescents and how we view the decision making that they do and all that kind of stuff, we know that they're not as capable as we once thought they were of making those kind of sound decisions where they're really thinking about levels of risk. And obviously, every teenager has their own experience. We know that there's lots of different things that impact on how young people feel and how they behave. But there's also a lot kind of that we still don't know really about adolescent brains and the impact that their environment and their experiences can have on them. But there's this kind of, idea that actually by looking at the differences between what it looks like for adults compared to teenagers, we can kind of learn a little bit more about how we support teenagers and what that should look like. Some of the kind of serious case reviews, as Steve touched on, there's been a little bit more interest recently with like the NSPCC and some of these serious case reviews around neglect in adolescence. But some of the kind of lessons and findings that came out from those was that what we've just been talking about, really, that teenagers quite often could be seen as mature, and practitioners sometimes could really struggle with kind of balancing the wishes and feelings of young people with what might be best for the child. There was sometimes that view of, well, they're old enough to know what they want, they're old enough to know what might be the best thing, and actually we know that that's not necessarily the case. And there was also some issues around, when teenagers missed appointments, for example, that there was sometimes that assumption that that was a lack of engagement, that was about teenagers choosing not to engage with us, when actually that might not be the case. And there is something in there about, even as teenagers still needing that support from parents and from their family, and the consequence of cases then being closed and saying, well, they're just not engaging with us, is that you then have a situation where adolescents are not being seen and they're not being heard. And a lot of the published case reviews have really highlighted that those difficulties that practitioners sometimes have with working with teenagers where there's some really complex issues, and that a lot of the interventions really focused on trying to tackle the behaviour rather than looking at what the underlying causes and risk factors were. And the result of that was that sometimes practitioners kind of lose sight of the fact that teenagers are also children and may also be in need of protection, rather than seeing them as young adults who can look after and keep themselves safe. So what do we mean by neglect? And I suppose particularly if we're thinking about adolescence. So one of the descriptions is the persistent failure to meet the child's basic physical and or psychological needs, likely to result in this serious impairment of the child's health and development. And there's that idea, as you can see in the NSPCC description, that about the real kind of need for that early intervention, and that they're often not recognised in teenagers, and even when they are, often it's not taken as seriously as it perhaps should be. It goes back to what I was just saying about their voice is not being heard and them not being seen. And there's also a real lack of research into neglect and the impact on adolescents. And this was certainly something that myself and my colleague Jess found when we were putting this together for you all. There's not been a huge amount of research. A lot of what we know is based on what we know about the impact on younger children as well, rather than specifically on adolescents. And so in 2010, Brandon et al. Did an analysis of serious case reviews after the death, or injury of a child or young person, and they found that almost a quarter of all the reviews involved a young person over the age of 11. And then for the young people in that category, suicide was by far the largest cause of death. And some of the underlying themes around neglect in teenagers is, again, what I was saying earlier about those symptoms being treated. So things like mental health being looked at in isolation, or being seen at kind of considered at face value, rather than recognizing that actually that could be a sign of neglect. And there's also that rhetoric sometimes of young people being labeled by professionals as being challenging or taking risks, which then led to them being seen as kind of the behavior being the problem and them being the problem, rather than, again, trying to really unpick what was underneath. And in 2016, the Children's Society kind of said that neglect is the form of maltreatment that's most often recorded in official safeguarding data, regardless of the age of children concerned. And it's one of the most prevalent forms of maltreatment that young people experience, according to what we know in research. And there's been, a bit of an increase in focus in the policy. And there's this idea that, sometimes kind of the way that we see adolescents, where they're seen as kind of having this more natural resilience to neglect, and it's therefore perhaps not taken as seriously as it might be with younger children, which then obviously means that in terms of that early help, that doesn't necessarily come through, and then things can get much worse before we start to step in as a professional network. And there was some research again by the Children's Society looking at kind of a bit more adolescence, and one of the things they found was that within the research they did, young people who experienced a higher level of care and support, that was kind of associated with a lower propensity for what might be seen as risk-taking behaviour, and they also had much higher emotional well-being. And the young people they spoke to, who kind of talked about multiple forms of neglect, so not having their health needs met, their education needs, that emotional support at home, had significantly worse levels of well-being than their peers who did not report that. So if we're thinking about kind of how do you kind of identify, what might adolescent neglect look like? So this is all taken from the strengths and needs toolkit. So there's a section 3.5 which specifically looks at adolescents, and so it's things you might be looking out for is things like parents not addressing medical issues, or addressing them when they've already kind of progressed and things are much further along. And that also includes looking at sexual health services, not promoting that access to it. Or I suppose on the other side of it, you might have access being promoted when it's highly inappropriate and it's not really the right time for that kind of thing. And then you've got things like that poor accommodation, so not having their own space, possibly having frequent moves, or having been staying with different people, different family members, different friends. Being homeless obviously is quite a specific one that you might come across a lot, particularly with older adolescents. And then the other one is looking at kind of other adults, frequently having other adults in the home. There was something in there as well about that sometimes also being linked with them not having their space or kind of losing their space to other adults that were frequenting the home. And then some of the things that you might obviously see in the other age groups as well, so being hungry, or preparing their own meals beyond what you would expect from that age. It kind of links in with what Karma would have been talking about yesterday with young carers. And there's this idea that when you're looking at parents, that idea of how able are they to see that teenagers will still need their support and their guidance. That kind of real resistance to accepting that they need that and that they might still need that parental support is one of those key factors. And you can read, some of the other ones, like they might have a caring role for siblings, presenting as unclean or not, that not being prompted in terms of washing, cleaning themselves, brushing their teeth, not accessing the support around like dental care or healthcare when they need it, and lack of boundaries. I suppose when you think about lack of boundaries, a classic thing you think is about, do parents know where their children are, or are they able to get them to school? But there's also that thing about, there's a real thing with technology now, isn't there, in this day and age? And do parents know what their children are doing? Do they have access to technology all the time? How much of an understanding is there around online safety? Is that being encouraged? Is that being discussed? Do parents feel able to actually engage in that with them? And then there's that worry, I suppose, sometimes that relationship becomes a little bit blurred. And when you're seeing situations where it's more like a friendship rather than a parent-child relationship, there might be times when that's appropriate and parents might be able to dip back in and out. But if you've got that consistent thing where they might be relying on the teenager for their own emotional support, then there's that worry there, isn't there, about where do the teenagers get that from themselves? Where are they getting that emotional support if they are offering that to the parent when it should be the other way around? And so just thinking about what we know about the impact that neglect has on teenagers. So as I said, some of these will be relevant to all age groups. You're looking at poor physical hygiene, or overall health, but there are obviously some specifics for teenagers. So that risk of exploitation increases when you've got the worries around neglect, that lack of engagement with education, mental health difficulties is quite a big one. Drug and alcohol use, entering the criminal justice system obviously is also that kind of significant factor there. And there's kind of, when we're thinking about some of these things, so in terms of like things like health, it's when you've got neglect of adolescence, it's more likely to involve kind of a failure to access or to accept health advice, and then it kind of increases those risk of that likelihood of risk taking behaviors. So especially if you're thinking about things like sexual health, we know that the risk of teenage pregnancy is higher, and them not getting that kind of health advice that they need and not taking it seriously enough as well. And we know that the impact on health, for example, is that teenagers experience worse growth, their lung function is poorer, they're at high risk of infection, they've got worse employment opportunities, and in neglectful homes, that situation might then be exacerbated by that indifference or that apathy that you might see from parents. So just thinking about kind of some of those conclusions. So those things to really think about is that, adolescents cannot fend for themselves. Obviously, they're at that really difficult stage where they're trying to kind of get some independence, and they're likely to be testing out their boundaries and what they can and can't do. But ultimately, they are still children. We know where they are neurologically, that they do sometimes make poor choices and make mistakes, and they don't necessarily have the ability to balance those risks with the strengths, and they can't look after themselves. They're not ready to do that yet. They're not too old to be neglected. There's often this idea, as I've said, that adolescents they can't be neglected, or that they're able to look after themselves, and that somehow mitigates that risk. But actually, for a lot of adolescents, the neglect that they're experiencing will be that continuation of their previous experiences, and it won't just be, that they turned 12 or 13 and suddenly they were neglected. For a lot of them, that would have been their consistent experience throughout their childhood. And they don't grow out of it. They don't grow out of being neglected. It's just that the impact of the neglect they've experienced when they were younger is going to start to grow, and that's when you'll start to see some of those difficulties that will then follow them into adulthood. And there's this idea that adolescence is a time for increased autonomy, but within that safe environment. It needs to be done with that support, with that emotional guidance, because it's also that time when those opportunities to escape from a family situation that is adverse and doesn't feel very supportive for a young person increases. And that's when you get those real push-pull factors, and you're more likely to see young people, becoming involved with situations like exploitation, gangs, drug and alcohol misuse, because that's their way of kind of getting out of the situation that they're finding themselves in. And it's that temporary relief, isn't it? Alcohol, drugs provides that temporary relief or possibly pleasure for someone where their home life might already be very chaotic, and that's their kind of escape for them. But we know that prefrontal cortex has still got several years before the development is complete. So even kind of an adolescent in those really positive social surroundings, they still don't have the same levels as an adult of reasoning and rationality. And ultimately it means that, it can leave children and young people feeling very, very lonely. And there are things, obviously that we can do to try and support with that. And part of that is around raising that awareness of it, trying to encourage young people's participation and providing kind of that local support around parenting. But one of the key things that's kind of come out is that need to try and address problems early, and really making use of like the CAF frameworks, the assessment frameworks, and that kind of ecological approach where you're looking at multiple different supports and interventions, to try and offer support to parents and adolescents as soon as we can.